Good afternoon, Joe. Thank you
Good
for
afternoon,
taking
Dr. Tsim.
good afternoon. Thank you for taking the time to have a chat with me today for the Scottish Mesothelioma Network Patient and Carer Education event.
It's a pleasure.
Um, I was just really keen to kind of run through the story of your journey so far for everyone, and I wondered if you could tell me a little bit again about your symptoms and what led you to go to your GP in the first instance.
Yeah, sure. Well, it was actually last summer. Uh, Hill walking is one of my main hobbies, and I noticed that in some parts of the hill I was getting out of breath, which was unusual. Uh, but gradually the breathlessness got worse, and so at the beginning of October, I arranged an appointment with the GP, and that took place on a Monday morning. The GP took bloods and requested a chest X-ray at the Gap Naval Hospital. The bloods came back showing anemia, which she said could cause breathlessness, but she wanted to get to the bottom of the anemia, and so she was going to get more bloods, more tests done on the blood. The chest X-ray appointment came through for the following Monday, so exactly a week after it was requested by the GP. After the chest X-ray on the Monday, on the Tuesday morning, the GP called and said that there was some pleural thickening and some volume loss on the right lung, and that she was going to request an urgent CT scan. The CT scan came through the following Thursday over at the Queen Elizabeth, and following the CT scan on the Monday, Dr. Thompson's secretary called me. Now, Dr. Thompson is the consultant at Gatton Naval in the respiratory unit. And he asked me if I could come in the next morning to see Dr. Thompson, which I did. And Dr. Thompson showed me a couple of images from the CT scan and the difference between the right lung and the left lung. And the difference was actually quite stark. The left lung was completely smooth and all the way around the perimeter of it, which I now know to be the pleura. And on the right lung, it was the complete opposite. It was very undulating and very bumpy in places, if I can put it like that. Now, Dr. Thompson said, now I'm paraphrasing all this, of course, Dr. Thompson said that this was cancer and more than likely mesothelioma, and that mesothelioma is a collection of small cancer tumours which sort of bind together and form this rind-like thing around the whole of the right lung. And that's what's happened here. And that the only way to confirm the mesothelioma was by a biopsy, and he would try to arrange that in the
And
following week.
can I ask, Joe, had you ever heard of mesothelioma before?
And I'd never heard of it. Now, he did ask me at that meeting, had I ever worked with asbestos? And at that point in time, I had absolutely no recollection of working with asbestos. But I now know it was a job 40 years ago that I came in contact with asbestos. And so, obviously, not having heard of mesothelioma, when I went home, I went online, which, with hindsight, wasn't the best thing to do, actually, because it was a pretty bleak landscape there. The prognosis was pretty grim from 6 months to 9 months, and that was pretty uniform across most of the sites I visited. There was no
And
site in
what?
particular.
Yeah, I was going to ask you what sites that seem to come up on your search or that you looked at.
They were actually mostly American sites, strangely enough, if I recall correctly. And I didn't stay specifically on the one because it was just articles based on mesothelioma in each of the sites. Even the NHS website had updated its mesothelioma article to uh, inform everyone about the new treatment that was now available, which I didn't know at that time, of course. But there was no particular website that I could mention and going back to, because pretty much all the articles were saying pretty much the same, actually.
Okay.
There was really no treatment, they were saying. Now, these were older articles, maybe a year or 2 years older, so they were unaware of this new treatment that had actually been published and trialled. So there was no actually specific website.
Okay. So Dr. Thompson arranged a biopsy for you, didn't he?
Yes, and your good self called me and introduced yourself and said that you would be doing the biopsy and that you'd looked at the CT scan, and the best option, in your opinion, was an ultrasound biopsy. And you had arranged that for, I think it was the following Friday. So it would be the following Friday after I seen Dr. Thompson. And I think you called me at the end of that week. So I think it was a Friday over at the Queen Elizabeth. And I met you there in the morning. I think I'm almost certain it was a Friday. And we both went into the ultrasound suite. And the radiologist was waiting there to assist with the biopsies. And you used the ultrasound machine to scan my right lung and find a suitable place to take the biopsy. You then proceeded to take several biopsies, and then I had to wait in the hospital, the day centre, for about 4 hours after that, just to make sure that you hadn't made a mistake and punctured the lung somewhere. And so, fairly soon after that, again, I think the following week actually, I had an appointment with Dr. Thompson again, and he confirmed it was mesothelioma. And as such, he was going to pass my care on to a Dr. Tsim, who was a renowned expert in the field, and she would be looking after me from now on. I then seen you maybe a week later, and you once again confirmed what Dr. Thompson had said, that it was mesothelioma and that it was biphasic, which means that there's both cell types present, the sarcomatoid and the epithelioid. And you said that the prognosis was 9 months. But you added the caveat that you had patients who had been living with mesothelioma for a number of years, and that you would put me in that category. Now, that's exactly how I felt at the time, actually, because although I couldn't be as active as I used to be and my life was somewhat curtailed, I was living a fairly normal life. I was walking around, I was doing the things that normal people would do. So I didn't feel that I was going to die anytime soon from a terminal illness. So I trusted implicitly in your judgment that I would be in that group that goes on for years. Anyway, at that meeting, you mentioned a trial which had just published the data, I think in April of last year, so that's April 2021. And it showed very promising results. And the trial was called Checkmate 743. And it was a treatment, an immunotherapy treatment of two drugs, nivolumab and I'm sorry, I forgot the name of the other one now. Ipilimumab, yeah?
Yeah.
Yeah, right. And that these had never been used, or I don't think an immunotherapy treatment had ever been used to treat measles before. In any case, when I went home, I checked it out, and here I did, well, there was Lancet articles and other articles, which, and the highlight was, of course, that the overall survival rate had doubled from 9 months to 18 months. So that was an incredible thing to find out. And here was hope, actually. Now, you were asking about websites earlier. Now, one of the websites that I found extremely useful, and this is strange to say this, was the Scottish Mesothelioma Network. And it was just all the little videos there from doctors, patients, and various, just highlighting exactly all the work that was going on with it, and mentioned the immunotherapy treatment and the results that came in. And I also, because I don't know about these drugs, I went into the NICE website, and if you type in the name of the drug, nivolumab, it tells you what it does, and ipilimumab, it tells you exactly what it does as well. And so when I read that, the science then made sense to me, because I could basically understand what it was doing. I mean, there are a lot of clever people involved in this, so for me to understand it is quite surprising. Anyway, and so the next person I then met after yourself was Dr Lumsden, who's a consultant oncologist at Gartnavel at the Beatson, which is the West of Scotland Cancer Centre, and I think he's part of your MDT team for mesothelioma.
Correct.
And obviously, the immunotherapy treatment and the Checkmate 743 trial had been discussed. And he was discussing that with me and decided that that was the best treatment for me. Basically, and that was another thing that came out of the trial, that sarcomatoid and biphasic sufferers actually did better than epithelioid sufferers. And so that was another reason to go down that treatment of immunotherapy. Now, the only fly in the ointment at that time was that although these weren't new drugs, they had been used previously in treating other cancers, there was no practical treatment. It had never been used in a practical sense to treat mesothelioma. And because of that, there was no license in Scotland, or indeed across anywhere in the UK. And so what Dr Lumsden had to do was prepare a sort of brief to present to the Greater Glasgow and Clyde Health Board for special permission, or a special license perhaps, to use this on me, because he put a case forward that this was the best treatment for me for whatever reason. And he was very confident that he would get this permission to use these drugs. And of course, I was extremely happy to see that, because that is exactly the treatment I wanted, because of such a positive outcome. And normally there's a meeting of whatever panel decides these things monthly. But in December, the meeting was cancelled because some of the panel members had caught COVID. And so the next meeting then didn't take place till January. So there was this sort of 2-month delay in getting a finding of whether we could use this or not.
And how did you feel with that, Joe?
Well, actually, I didn't. It was because Dr Lumsden was so confident. Obviously, I would have liked the result sooner, because I would have liked to have started the treatment sooner. But because Dr Lumsden was so confident in getting permission, I wasn't really too worried about it. Anyway, the permission came through in January, and I started immunotherapy treatment on the 7th of February, which is a Monday. And the treatment consists of both the drugs on the first week, and then 3 weeks later, just the one drug, the nivolumab, and then a further 3 weeks later, back to the 2 drugs again, and so on. I've maybe 2.5 weeks ago, I finished that sort of first 6-week cycle, or the second double dose, and in a few days' time, I should be getting the single dose. And then obviously 3 weeks after that, I'll be getting both drugs again. And that's pretty much where we are just now, actually.
And how have you found the immunotherapy so far? How has it been affecting you, or is it tiring going up and down to the Beatson?
Going up and down to the Beatson, no, not at all, actually. I actually walk up from here, because it's only a mile up the road, and it's pretty flat. The only obstacle I have is the footbridge going over at Highland Station. And normally that wouldn't be an issue, obviously, but I use a lift there now, you know. So I walk up and my daughter picks me up afterwards because the appointment's at 3:30, and it's usually 5, 6 o'clock time I get back out. Yeah, so I didn't find the obviously with these two drugs, these two strong immunotherapy drugs getting put into your body, there is an impact there, and sometimes it can be quite severe. Now, it did impact me after the first double dose. I did seem to get a bit more breathless, and I became extremely lethargic. I was actually fighting with myself not to go back to bed in the afternoon. And so when I went up to get my bloods done, the procedure is on the Friday I get bloods done, and if they're okay, I then carry on with the treatment on the Monday. So when I went to Garton Naval Clinic to get the bloods done, Louise, who's a specialist Beatson nurse, spoke to me, took me in, and I told her how I was feeling. And she said, if the hemoglobin comes back low, because of my symptoms and the way I was presenting, she would order a unit of blood to be given immediately prior to the nivolumab, which was the next treatment. The hemoglobin did come back low at 97, and she did order a unit of blood, which I was given immediately prior to the nivolumab. Now, it did take 3 hours to administer this unit of blood, but my God, it was worth it. The next day, I couldn't tell you the difference. I was back basically to what I was before the treatment started, and I'm still much the same. Actually, I'm still fairly active. The next thing that then happened was my ulcerative colitis seemed to flare up, and then it eased again just before the next treatment, which would be the 2 drugs. And then soon after I got that next treatment, it seemed to flare up again. So I thought, right, maybe I think I got a treatment on Monday, and it was the Thursday I phoned the Beatson helpline and explained to them what the circumstances were. And they told me to come in for an assessment, to bring an overnight bag, just in case, because if it was serious, they would be giving me intravenous steroids, and they would have to stay in overnight. So I went up to the Beatson on the Thursday afternoon, and I went into an assessment ward, and I stayed in overnight. I didn't get any treatment, I didn't get any steroids. They did put a cannula in just in case it was required. And then I got out the following day because they assessed it as being mild enough not to warrant any steroid treatment. And so, and all I was to do was monitor it, and if it get worse, then I was to get in touch with them. But thankfully, it hasn't got worse. And so, in a few days' time, I'll hopefully be getting the next treatment of the drug, which is just a single dose of nivolumab.
And you recently had a CT scan, didn't you?
Yes, I haven't had the results of that yet.
So you're still waiting on the results?
Yes, I'm hoping when I go on Friday to get the bloods, I'm assuming that Dr Lumsden, because of the CT scan, will want to see me. We had left it the last time I spoke to Dr Lumsden when I got the 2 drugs, that when I was getting the single dose of drugs, it would just be a telephone call. A telephone interview just to see how I was, etc. He would either phone or Louise, the Beatson specialist nurse, would phone. But I'm hoping that because the CT scan was done, that I'll get to see Dr Lumsden on Friday, and he can explain what the CT scan was. Now, this would be obviously the first CT scan after the treatment started. In fact, it's the first CT scan for 5 or 6 months since I went back in October. Now, you had warned me, and when we were talking about the Checkmate 743 trial, that the first CT scan is pretty inconclusive because it doesn't really tell you if the treatment's working. And it will be the next CT scan in 3 months' time, which will really be the decider. And so that'll be probably in July, I think it will be. And so it will be the summer again before I find out if the treatment's been successful. And I expect I'll know in June or July if the treatment's successful, because I'm hoping that I'll get a bit less breathless. Because one of the things that I found when I was researching the Checkmate 743 trial was a newspaper article down in England somewhere from a man who'd been on the trial in 2017. He started the trial in October and had to come off it in December because he developed hepatitis. And so that was in 2017. This article was, I'm sure it was last year's article, but it may have been the year before, but it was a number of years after this the trial. This man was on the trial, and he seemed to be getting benefits over the years from the treatment, because what it said in the article was that his pleural thickening, which was 27 millimeters, had been reduced to 5 millimeters. Now, I don't really need to have it reduced that much. All I need to do is hopefully have it reduced enough that I can then get back to some hill walking, build up my fitness again. I'll never be as fit as I want. I know I don't expect to be, but if I can get part of my life back, and that main hobby of mine, then that will make, and that's really what I'm hoping for. And I hope I may in June or July feel that it's taken effect.
Great. And can I ask through all this, Joe, how have you found the support? Has there been anything that you wish could have been a bit better from a support perspective, or have you been quite happy?
No, as far as the hospital goes, it's been absolutely. I mean, it's at the very start of the clinic in Gartnavel. Sister Smith, Alison Smith, who is a sort of specialist nurse there, she took a lot of time with me discussing things, etc., explaining certain things. And then, of course, there's Caroline, who's a measles specialist nurse, and she's been brilliant at finding out things for me. If I ask a question about certain things, and of course, Louise, the Beatson nurse, and of course, all the staff, all the nursing staff at the Beatson's been incredible. And of course, the family. Although I didn't involve the family until a couple of days after Dr. Tsim confirmed that it was cancer and it was mesothelioma. I had my oldest daughter, Alison, who lives within a mile here. I told her a couple of days after the results of the chest x-ray, and she sort of became my personal Uber driver. She takes me to appointments, takes me for scans, etc., and picks me up from the Beatson after treatment. So, and of course, as soon as the family finds out, then they go on a very similar journey to yourself. They go online, of course, and check out certain things, and then, of course, initially it's a bit of a downer, but then when the Checkmate 743, I informed them of that. Then, obviously, then there's a lot more hope, and so. Yeah, so between the hospital and the family, yeah, there's been absolutely plenty of support.
Great. Well, thank you for taking the time to speak to me this afternoon. And I hope as well that you can get back to the hills come the summer.
Thank you. Thank you.
Thank you.